Hey everyone, it's good to see you again. So here's something that affects millions of Americans right now. The government's new update on Medicare Open Enrollment. It might sound routine, but this year it's anything but. And here's something most people don't realize. Starting next year, Medicare plans will include a $2,000 cap on annual out-of-pocket prescription drug costs. That's one of the biggest changes to the program in years, and it could save many people a lot of money. So yeah, this is one of those topics you really don't want to tune out on, because what you learn here could make a real difference for your wallet and your health care. Before we get started, I'd love to know, what's the one thing you worry about most when it comes to your Medicare or healthcare coverage? Is it cost, coverage, or maybe just trying to understand all the options? Let me know in the comments below. Now, I spent hours reading through the official Medicare updates and policy changes, so you don't have to. I'm breaking it all down in plain English today because this stuff is too important to ignore. Let's start with what's actually happening right now. Medicare Open Enrollment is underway and it runs through December 7th. This is the one time each year when you can review your plan, make changes, or switch between different types of coverage. And even if you think your plan is fine, here's the truth. Things change every single year. Doctors may leave your network. Copays can increase, and benefits that used to be included might quietly disappear. You might not even notice until January when it's too late to fix. According to the administrator of the Centers for Medicare and Medicaid Services, sometimes these policies change without you knowing it, and you'll have a worse experience next year if you don't check. And honestly, that's absolutely right. Insurance companies make adjustments every year. They can raise or lower premiums, change provider networks, or tweak prescription drug coverage. So yeah, even if you're happy now, it's worth taking a fresh look. It could save you hundreds, maybe even thousands. Now here's where things get a little more serious. The average Medicare Part B premium, that's the one covering outpatient services and doctor visits, is expected to rise next year. It currently averages about $185 a month, and it could go up by around $20. That might not sound like much at first, but for someone on a fixed income, that's real money every month. If you're a senior living on Social Security, an unemployed worker who recently qualified for Medicare due to disability, or a veteran trying to make ends meet, that extra $20 can mean choosing between medications or groceries. I've heard from viewers before who said they woke up in January to find their doctor was no longer in network, or their copay for a heart medication doubled. And when you're retired or on disability, that kind of surprise isn't just inconvenient. It can throw off your whole budget, but it's not all bad news. Some Part D plans, those are your prescription drug plans, may actually see slight decreases in premiums. And Medicare Advantage plans, which bundle hospital, doctor, and drug coverage through private insurers, are expected to stay stable or even drop in cost for some enrollees. Plus, there's that huge $2,000 cap on prescription drug costs I mentioned. If you're someone taking expensive medications for diabetes, heart disease, cancer treatments, or any chronic condition, this cap could be absolutely life-changing. And here's another big development. The government's approach to drug pricing is changing. The administration introduced what's called the Most Favored Nation model, which essentially forces drug companies to charge Americans the same or similar prices they charge in other countries, like Canada or Germany. In the past, Americans often paid 2 or 3 times more for the exact same medication. When you buy a drug in America, it's often 3 times higher than in Europe, even though it's made in the same factory. That's what this reform is targeting. And while there's still debate about how much it'll lower prices right away, it's a step toward fairness and affordability. So who exactly needs to pay attention to all of this? If you're currently on Medicare, whether that's Original Medicare or Medicare Advantage, you need to review your plan. If you're a caregiver, if you're helping your mom, dad, or another loved one navigate this, your involvement could save them hundreds of dollars or prevent coverage gaps. If you're on disability, if you qualified for Medicare due to disability, even if you're under 65, these same rules apply to you. If you're a veteran, even if you have VA benefits, many of you also have Medicare, and understanding both systems is crucial. If you're on a fixed income, whether you're living on Social Security, a pension, or disability payments, every dollar matters, and there are special programs that can help reduce your costs. Okay, so what should you actually do? Let me give you the step-by-step. Step 1. Find your annual notice of change. The first step is to grab the letter your current plan sent you. It's called the Annual Notice of Change. Every plan has to send it out before open enrollment. That letter outlines exactly what's changing for next year: your premiums, co-pays, deductibles, medication coverage, all of it. If you didn't get it, call your plan and ask for a copy. Look carefully at any differences. If anything feels off or you're unsure, it's a sign to start comparing options. Step 2. Use Medicare's comparison tool. Speaking of comparing, Medicare's website actually makes it easier than you might think. If you go to Medicare.gov, you can plug in your prescriptions and even your favorite pharmacy to compare plans side by side and estimate what they'll cost next year. Just keep in mind the doctor network listings aren't always perfect, so it's a good idea to double-check directly with your provider before making your final choice. Still, it's one of the most helpful tools for avoiding those January surprises. Step 3. Check for new benefits. Here's something new this year that's worth paying attention to. Some Medicare Advantage plans are expanding their supplemental benefits. That means they can offer things like help with groceries, transportation to doctor visits, utilities, or gym memberships. Those are real, tangible perks that can improve quality of life. But, again, those benefits vary by plan and location, so check carefully to make sure those offerings actually apply to you and that they're not just marketing fluff. Step 4. Don't wait until December 7th. You have until December 7th to make changes, but don't wait until the last minute. Even though the tools are better now, there's still a learning curve. And if you're not comfortable using the website, the Medicare hotline is still staffed by real people who can walk you through your options. If you're new to Medicare this year, you actually have a bit more flexibility. First-time enrollees often get a longer window to choose or adjust plans. But still, don't procrastinate. Now, I know some of you might be wondering, what about the government shutdown? How does that affect Medicare? Well, here's what we know. There's been ongoing political tension around government funding, and it's added confusion to an already stressful process. There's been debate about funding tied to various healthcare programs, with both sides blaming each other. But here's the important thing to know. For now, your Medicare coverage and open enrollment are not affected. The system is still running, and you can still make your plan changes through December 7th. But it does highlight how politically charged these programs have become. Medicare isn't just a healthcare issue anymore. It's a central topic in national politics, tied directly to how we fund the government and balance the budget. So what can you control right now? The answer is simple: your engagement. You can't control Washington politics, but you can make sure you're not overpaying or missing coverage because you didn't double-check your plan. You know, one of the most common messages I get from people around this time of year goes something like this: I just don't know where to start. And I get it. Medicare can feel confusing. Between the letters, parts, premiums, and plan types, it's easy to feel overwhelmed. But here's the truth. You don't need to know everything. You just need to take one step. Look at what you have. Make sure it still fits. And if not, make the switch. That's it. Let me address a few specific situations. If you're on a tight budget, there are programs like extra help for prescription drug costs and Medicare savings programs that can reduce your premiums and out-of-pocket expenses. If you make less than about $22,000 as an individual, or $30,000 as a couple, you might qualify. If you're relatively healthy, don't just pick the cheapest plan. Make sure it still covers your preferred doctors and has reasonable costs if something unexpected happens. If you have chronic conditions, look for plans that offer disease management programs or those supplemental benefits I mentioned, things like meal delivery, transportation, or care coordination. If you're helping someone else, be patient. This process can be confusing and emotional for older adults or people dealing with disability. Make it a conversation, not a lecture. If you take away just one thing from this today, let it be this: engagement matters. Medicare isn't set it and forget it. The system gives you tools, but it's up to you to use them. December 7th is the deadline. And after that, you'll be locked into your choice for the next year. So take a few minutes this week, grab your paperwork, hop online, or make a quick call, and make sure you're getting what you deserve out of the plan you're paying for. And if you've ever had a bad experience with Medicare, maybe a doctor dropped out of your network or a prescription suddenly cost more, share that in the comments. Your story might help someone else avoid the same problem. If this video helped you understand what's going on with Medicare Open Enrollment, hit that subscribe button. I make videos like this breaking down government programs, benefits, and resources that can actually help you. Drop a comment and let me know. Are you reviewing your Medicare plan this year? Have you found a better option? Are you helping a family member through this? And if you want more help navigating benefits, check out my other videos on Medicare Advantage versus Original Medicare and how to save money on prescriptions. I'll link those in the description. Remember, you've got until December 7th. Don't wait, you've got this. Thanks for watching, take care, and I'll see you in the next one.